Hello everyone, good morning. My name is Oshin Thapa and I am here to discuss the topic of foodborne infections. The first foodborne infection is Campylobacter jejuni, which is widely distributed in nature, can be isolated from meat, milk, vegetables, and fish. Transmission: bacteria produce a toxin that causes illness. Vomiting type outbreaks have usually been associated with rice products and other starchy foods such as potatoes, pasta, and cheese products. Sauces, puddings, soups, casseroles, pastries, and salads have also been implicated in outbreaks. Symptoms: food poisoning is characterized by nausea and vomiting 0.5 to 6 hours after the ingestion of a contaminated food product. In more severe cases, abdominal cramps and diarrhea might occur, with symptoms lasting up to 24 hours. The next foodborne infection is Escherichia coli, which is found in the intestinal tracts of some mammals. Raw milk, unchlorinated water, one of several strains of E. coli that can cause human illness. Contaminated water, raw milk, raw or rare ground beef, unpasteurized apple juice or cider are the transmission areas of this foodborne infection. Uncooked fruits and vegetables may vary person to person. Symptoms are diarrhea or bloody diarrhea, abdominal cramps, nausea, and malaise. Can begin 2 to 5 days after food is eaten. Some, especially the very young, have developed hemolytic uremic syndrome that causes acute kidney failure. A similar illness, thrombotic thrombocytopenic purpura, may occur in older adults. The next foodborne infection is Listeria monocytogenes, found in the intestinal tracts of human and animal. Milk, soil, leaf vegetables, and processed foods can grow slowly at refrigerator temperature. Soft cheese, raw milk, improperly processed ice cream, raw leafy vegetables, meat, and poultry are the transmission areas. Illness caused by bacteria that do not produce toxin. Symptoms: fever, chills, headache, backache, sometimes abdominal pain, and diarrhea. 12 hours to 3 weeks it may last. May later develop more serious illness in at-risk patients. Meningitis or spontaneous abortion in pregnant women also occur. Sometimes just fatigue. Next foodborne infection is Norwalk virus group. The virus has been identified in clam and oysters by radioimmunoassay. It is typically shed in the feces of human. It is transmitted by the fecal oral route via contaminated water and foods. Shellfish and salad ingredients are the foods most often implicated in Norwalk outbreaks. Ingestion of raw or insufficiently steamed clams and oysters possess a high risk for infection with Norwalk virus. The next foodborne infection is Salmonella, which is found in the intestinal tract of species of animals. Salmonella enteritidis is one of the infection in raw eggs. Transmission: raw or undercooked poultry and meat, raw milk and dairy product, seafood, and food handlers are the transmission areas of this foodborne infection. Symptoms are stomach ache, diarrhea, nausea, chill, fever, and headache usually appear 8 to 72 hours after eating, may last 1 to 2 days. The next foodborne infection is Shigella, which is the which is found in the human intestinal tract, rarely found another animals. Transmission: person to person by fecal oral route. Fecal contamination of food and water. Most outbreaks result from food, especially salads, prepared and handled by workers using poor personal hygiene techniques. Disease referred to as cirrhosis or bacillary dysentery, diarrhea containing blood and mucus, ab- fever, abdominal cramps, chills, and vomiting. 12 to 50 hours from ingestion of bacteria can last a few days to 2 weeks. The next foodborne infection is hepatitis A virus, which is widely distributed throughout the world, occurring in both epidemic and sporadic cases. Hepatitis A is primarily transmitted person to person by the fecal oral route, but common source transmission does occur. Transmission: excreted in feces of infected people and can produce clinical disease when a susceptible individual consumes contaminated water or food. Cold cuts and sandwiches, fruit juices, fruits, milk and milk products, vegetable, salads, shellfish, and iced drinks all can be considered vehicles for the transmission of hepatitis A. Symptoms: usually a mild illness characterized by sudden onset of fever, malaise, nausea, and anorexia, and abdominal discomfort, followed by several days of jaundice. So, this is the end of the slide. Thank you.